Hi team, in this video we are going to be doing some hand and heart breath work, and this is a really effective tool for helping you if you're feeling overwhelmed, disconnected from yourself, perhaps lonely or sad, something's upset you, or if you are feeling anxious as well. It's a really great tool for helping to soothe and alleviate some of the sensations that come with those emotions and bring you back into your body and back into connection with yourself. The main things that we need here is our breath and our hands, to place our hands on our heart. So you want to make sure that you're wearing some clothing where you can place your hand on your heart and you can feel the warmth of your hand against your skin. So not wearing too many layers. And the reason for this is that when we feel our connection with ourselves, with the warmth from our hand over our heart, that connection is extremely nourishing, and it helps us to self-regulate and to provide comfort for ourselves in difficult moments, and that sends back the information to our nervous system that we are capable of taking care of ourselves, that we have got our best interests at heart. And that is a really important part of healing from the effects of trauma, healing from traumatic situations, and healing and restoring, should I say, a very stressed or dysregulated nervous system, because often trauma and stress force a disconnection between ourselves, a disconnection from ourselves. And so this practice of just slowing down, holding ourselves, feeling the warmth and the support from ourselves is extremely nurturing and has many wonderful benefits. It can help to reduce stress hormones, to improve heart rate variability, and to help us rest and move back into that parasympathetic state in a relatively short period of time. So we're going to be doing this for about 5 or so minutes. I want to invite you to remember that as this is a trauma-informed video, if at any point you feel like this is too much for you, you can pause the video and come back to it another time when you have the capacity. And if it feels unsafe for you to connect with your body in this way, and I really strongly suggest that you seek the support of a somatic trained practitioner like myself or somebody else that can help you to restore your capacity to resource, to ground, and to do this work as safely as possible. So finding yourself in a comfortable position, allowing the spine to straighten. But I'm supported, I'm in the corner of a sofa here. So I'm really well supported. I've got a cushion behind my lower back, loose fitting, comfortable clothes. My hands at the moment are on my legs. And just take a moment to look around the space that you're in, just to orient to the space that you're in. As you're breathing in, grounding down, looking around the room, allowing your nervous system to take in the space that you're in. Notice if you're bracing. See if there's anywhere in your body that you can just relax that little bit more than before on the exhale. Feel yourself grounding down. As you look around, and then bring your attention back to your body, looking down at your body. Take one or both hands and place them on your heart and feel that warmth. You can also lie down if that feels more supportive to do so. And I'm inviting you now to breathe in for the count of 4, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale. Exhale. You can exhale out through the mouth if you like. Inhale. Allowing the eyes to soften. Exhale. Inhale. Exhale. Feeling the warmth of your hands. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Letting yourself know you are here. Inhale. Exhale. Inhale. Letting the shoulders drop. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Allowing there to be any audible exhales. Inhale. Exhale. Feeling the warmth of your hands on your chest. Inhale. Exhale. Allowing the body to soften. Inhale. Exhale. Inhale. Knowing that you're here for you. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. If any emotions come up, that's fine. Inhale. And if they don't, that's fine too. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. If you feel the need to yawn or stretch, do so. Exhale. Inhale. Exhale. Exhale. Inhale. Exhale. Inhale. Exhale. Notice if there's any bracing. Inhale. And soften. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Just returning to your normal breath for a few more rounds. Allowing the hands to come back to the thighs if you like, or you can continue with this practice and just notice how you feel. Hopefully you're feeling more connected to yourself, more supported by yourself, more seen and felt by yourself. And allow yourself to continue noticing the effects of this practice after it's finished. Or if you feel like you need to continue it, go ahead and do so. Remember to orient to the room, come back to the space that you're in. If you want, you can gently squeeze muscles in your body with your hands. I'm gently squeezing up the calves. Bring myself back into the body and into the present moment, squeezing my thighs, my hips, my ribs, squeezing my arms, forearms, squeezing my hands, taking a nice stretch in whatever way feels good for you. Oh, letting yourself have a few more audible exhales to release any lingering tension. Thank you very much for joining me for this hand on heart breathwork practice. It's a really good practice to do, like I said, if you're feeling anxious or lonely, or you've got some sadness. Also, if you're feeling wired and tired, you can't relax very well, it's a great activity to do before you go to bed. Also to do after if you've had an argument with somebody. And I actually use this technique when I'm struggling to get back to sleep at night. So often I have the 3 a.m. wake up. Being a woman in my early 40s and I really like to practice hand on heart breathing with coherent breathing at night when I'm in bed, and I find this really supportive and really nourishing, and it often gets me back off to sleep relatively quickly. So if you are somebody that is on their healing journey and you're looking for support, my name is Donna Louise, and I'm a trauma-trained somatic practitioner, a functional breathwork coach, a clinical EFT practitioner, and also a trainee counsellor. And I help people to get out of survival mode, to restore their nervous system, and to reconnect with themselves. If you've enjoyed this practice, consider saving it, downloading it, give it a like, share it with somebody, and if you haven't already, subscribe to the channel. Also, if you've got any questions, any comments, any concerns, please pop them in the comments section below this video. I'd love to hear from you and see if there's a way that I can continue to offer support. Thank you very much for watching, and until next time, take very good care.